patients that are really apprehensive about dental treatment where they having it done just with local anesthetic or with local anesthetic and nitrous oxide isn't comfortable for them. They're too apprehensive to be comfortable at that level. We offer oral sedation. Oral sedation varies from IV sedation in that the medication is taken by mouth versus in a vein. I have done many IV sedations for many years and have switched now to just doing the oral sedation because the effectiveness is very similar. It's slower to get the person sedated, but once they're there, they're comfortable for a longer period of time, and it makes it much easier for dental appointments that are of a long duration, because usually if a patient's going to be sedated, they want to get most of their work done at that visit if possible. So it works very well. Its medication is very similar to an IV sedation. They make you very relaxed, very drowsy, very out of it. Your memory of the appointment is very minimal, if any at all. It's a very safe procedure in that you're still responsive. You still have all your natural reflexes of breathing. Nobody's helping you breathe like a general anesthesia or anything like that. You're monitored constantly with what we call a pulse oximeter. That measures your oxygen level, your blood pressure, your heart rate, all during the procedure, so we're constantly aware of that. The nice thing about oral sedation is that under our tongue, we have lots of blood supply, very large blood vessels under there. So if during the procedure we need to add more, it's very easy just to crush the medication, lay it right under the tongue. It gets absorbed fairly quickly. Again, not as fast as an IV, but very effective. All the medications are reversible too, if we ever have any problems, safety-wise. And so in that regard, it just makes it a very pleasant way to have your dentistry done, because you just don't really remember what happened and not aware of the procedure, how long it took, everything that's happening in your mouth. To receive your permit from the Arizona State Board of Dental Examiners, you have to complete a certain number of hours of continuing education in sedation. And then you have your office visited by 2 examiners, and they check all of your equipment, all the medications that you're using, all the forms that you're using, your techniques that you're using, to make sure that you have everything that is possible to need in case of any emergencies, that sort of thing. We also do an oral exam with those examiners every 3 years to update our permit, where they go through every scenario possible of medical emergencies and how would you handle it. And so it's a very well-controlled, very rigorous situation. So that's the minimum of having. I, after dental school, did a general practice residency for a year, and during that period of time, I spent 2 months in a hospital where I was actually doing general anesthesia as part of the training that we had. And then also during our clinic times, we were trained to do regular IV sedation also. And then for many years in practice, I did the IV sedation before I just found that the oral sedation tended to work better for patients and for the dental appointments and the type of treatment that we were doing.